What is High Blood Pressure by Tom Seast. Author's note. This video and presentation contains lots of difficult to pronounce Latin names for different drugs and medications. In some cases, I make the attempt to actually pronounce them correctly. In other cases, I don't read them at all. My apologies. What is high blood pressure? If you follow me on social media, you are likely to experience high blood pressure sometime during your lifetime. I don't believe following me on social media would be the primary or contributing cause of your high blood pressure. Most adults will likely be diagnosed with high blood pressure at some point during their lifetime. You should understand the condition to identify and resolve it if you encounter it. Under pressure. Most people have probably heard the song made famous by the band Queen titled Under Pressure, which you can listen to by following this link. If you read the song's lyrics, you'll quickly determine that it's not a good thing to be under pressure. Pressure is the force exerted on an object by another object. In this case, high blood pressure would be considered excessive pressure of blood as it moves through the arteries or blood vessels. You can picture a balloon that is ready to burst, or me wearing a super tight pair of jeans. No one wants to be around when the item under pressure explodes. Why is high blood pressure bad? According to the Center for Disease Control, nearly 500,000 people die in the United States each year, with high blood pressure being named as the primary or contributing cause of death. If you are diagnosed with high blood pressure, also known as hypertension, you have a higher risk of heart disease, heart failure, heart attack, atrial fibrillation, and a greater risk for stroke, dementia, and kidney disease. The high blood pressure itself isn't necessarily the problem, but can serve as an indicator of other underlying issues. What causes high blood pressure? There are many different known causes of high blood pressure, and they include alcohol consumption, smoking, sleep apnea, obesity, aging, diabetes, stress or anxiety, physical inactivity, autoimmune conditions. Some doctors also believe that genetics can be a cause of high blood pressure. While some treatments and therapies can help you lower your blood pressure, you must try to determine the primary and secondary causes for the condition and reverse and eliminate them as quickly as possible. Inexpensive ways to lower blood pressure. While it may seem obvious, you need to experiment with lifestyle changes and determine if they positively impact lowering your blood pressure. If you suspect that consuming alcohol, smoking, stress, anxiety, or diabetes is causing your high blood pressure, do your best to eliminate those problems in your life. A diabetes diagnosis can be reversed in some cases by making changes in what you eat. If you're not getting enough physical activity, add simple things like walking and stretching to your daily routine. Other conditions may involve the services of coaches, doctors, and nutritionists, as each case is different. Types of blood pressure medications. Doctors describe many different types of blood pressure medications that include angiotensin converting enzyme inhibitors or ACE inhibitors, alpha blockers, angiotensin receptor blockers or ARBs, beta blockers, calcium channel blockers, central agonist, combination medications, direct renin inhibitors, diuretics, peripheral adrenergic blockers, and vasodilators. Each medication may have side effects and may or may not provide benefit. Your doctor will prescribe treatment based on how elevated your high blood pressure is, what may be causing it, how your body responds to the treatment, and any of your other health problems. Your pharmacist will likely work with you for a plan to try and monitor each attempt at treating your high blood pressure. Angiotensin converting enzyme inhibitors, or ACE inhibitors. An ACE inhibitor can prevent your arteries and veins from tightening up by preventing your body from producing a hormone that is made to cause this effect. Your doctor may prescribe a medication with a name ending in pril to act as an ACE inhibitor. Supplements made with black cumin seeds may also act as ACE inhibitors. Alpha blockers. Alpha blockers can stop the signals that pass through the nerves that cause the arteries to restrict, and this can cause the arteries to relax, lowering the amount of pressure on the walls of the arteries. Angiotensin II receptor blockers, or ARBs. An ARB medication acts against the same hormone that the ACE inhibitor restricts. In the case of an ARB, it prevents the hormone from being able to attach to the muscles which cause the blood vessels to restrict. The names of these drugs commonly end with the phrase TAN. Beta blockers. Beta blockers are used to slow down your heart rate, which causes the heart not to pressurize the blood so much, which lowers the pressure on the walls of the arteries. Foods or supplements that contain magnesium, potassium, L-arginine, tryptophan, antioxidants, St. John wort, fish oil, or fiber may have an effect similar to a beta blocker. Avoiding caffeine in coffee, sodium, or energy drinks may also lower the heart rate. Calcium channel blockers, or CCBs. Also called calcium antagonists, these medications block calcium from entering certain cells in the blood vessel and heart, which reduce the conduction of electrical signals. This has the effect of either slowing down the heart rate or relaxing the arteries and veins. Some studies suggest that consuming more calcium in food or in supplements may actually act as a calcium channel blocker. Supplements made with black cumin seeds may also act as a calcium channel blocker. Central agonist. Medications of this type may be referred to as central acting agents, central adrenergic inhibitors, or central alpha agonist. They keep the brain from signaling an increase of the rate at which the heart pumps, which lowers the pressure and keeps the blood vessels from narrowing. Combination medications. Pharmaceutical companies have created drugs that combine medications from more than one of these types of antihypertensives and have created combination medications like these. Direct renin inhibitors. Direct renin inhibitors affect the enzyme renin targeted by ACE inhibitors and ARBs and stop it from causing reactions that make the hormone. Diuretics. Your doctor and people in general may refer to these as water pills because they can help your body get rid of salt and water. Removing more water from your body helps reduce the pressure on the walls of the arteries. Foods like eggplant, asparagus, watermelon, and onion can also act as diuretics. Beverages that contain alcohol or caffeine can have a diuretic effect as well. People have also had good results with some herbs like hawthorn, parsley, and corn silk. Peripheral adrenergic blockers. Although doctors tend to not prescribe this class of drugs, these drugs will prevent nerve signals from reaching the blood vessels that cause the vessels to tighten up. Vasodilators. Vasodilators cause the muscles in the walls of the arteries and veins to relax, which results in wider blood vessels. This lowers the pressure on the walls, lowering the blood pressure. There are two common medications prescribed in this class. Foods and supplements that include garlic, artichoke, hawthorn, flaxseed, turmeric, cinnamon, berberine, ginger, and ginkgo can act as vasodilators. Eating avocado or drinking green tea can also have a vasodilating effect. Any supplement containing nitric oxide may also act as a vasodilator. Just relax. Knowing that you have elevated blood pressure can cause you to have stress and anxiety, and that can give you higher blood pressure. It is important to at least understand what may be causing your high blood pressure and potentially eliminate or reduce the primary and secondary causes. Whether you're trying to implement lifestyle and dietary changes to reduce your blood pressure or taking medications, you should now have a better understanding of how these various alternatives work with your nervous system and your circulatory system to reduce the pressure of the blood passing through your veins and arteries. And this additional knowledge may help you to relax. To be continued. As I get more time, I'll produce an article that provides links to the science behind each of these classes of drugs, known side effects, and any science regarding the herbs and supplements that may act in the same way.